what I called PPACA, but now our president owns the name Obamacare, so I go back and forth. It was around 15 months ago, and a whole lot has changed. Now, in case y'all don't know who I am just a doctor. I'm not a policymaker. I'm a Wahoo ×2, having gone there for undergraduate and medical school, did my orthopedic surgery training at Wake Forest, my hand fellowship at Tufts University in Boston. I'm a former orthopedic chairman. I've been a member of the Quality Committee, Credentials Committee. I'm currently a medical director of hand therapy, and I'm a member of various organizations there, most notably representing Government Affairs Committee in the American Society for Surgery of the Hand, and I'm president-elect of the Norfolk Academy of Medicine. But again, I'm not a policy University of Virginia graduate. Yes. So again, the last time I spoke was around 15 months ago. We were discussing the Trojan donkey of Obamacare. And I'm going to just share a couple of personal vignettes at the very beginning. I was trying to decide how I would present Obamacare now, and the first thing I ever wanted to be in life was a meteorologist. And I wanted to be, at age 10, just like this woman here, Janet Peckinpah, okay? And Obamacare, it really it's been like watching a hurricane approach. And so it's I feel very analogous to a meteorologist. And, that's right. And so I very much felt like Janet Peckinpah forecasting the hurricane 15 months ago, and now it arrives. And I was very surprised that I actually could find a picture of her from 1978. She was a meteorologist in Richmond. And ironically enough, some of our commonalities continue because she actually ran for Congress in the 2nd District up in Connecticut, mind you, in 2010, and lost a closely contested race. So I thought that was pretty interesting, a meteorologist turned politician. So now here we are, Healthcare 2014. The Trojan donkey is here. What I'm going to discuss today are what we're seeing, some of the early effects of Obamacare, nationally, locally, and then what I've seen, my personal observations in my practice in my life. We're going to discuss a big topic for Virginia right now, which is, of course, Medicaid and whether to expand or not. And where do we go from here? So the hurricane is approaching. The outer bands are hitting currently. And what we're seeing is, one of those skipped. What we're finding right now is that those who passed the bill are now getting to see what's in it. So Nancy Pelosi is getting to see exactly what's in this 2,000-page law. We're seeing that individuals are losing their coverage, millions and millions, and the cost for almost all others is going up. The website, predictably, is a disaster, and the administration essentially this time is trying to save face through the next election cycle by making at least 30 changes to the law so far. I'm briefly going to touch upon just a few of the administrative actions because these have gotten a lot of press and we don't need to drill down too much on this. We know that one of the administrative actions is that Congress now has an opt-out. So even though it's good enough for the rest of us, we are actually going to continue to fund their health care. They're concerned that there will be a brain drain if we don't. Instead, I think we'll see the brain drain in small business and in medicine. We've seen a delay in the individual mandate, actually of approximately 6 weeks. We've seen, of course, a 1-year delay in the employer mandate. We've seen a 1-year delay in the small business initiation of the federal exchanges. We have seen that many people, because their insurance plans in the individual market did not meet what Obamacare set out, their plans were canceled, but then you saw the administration backpedal and say, oh, no. They can offer those plans again because there was so much kickback on those individual plans being canceled. And as a result of the employer mandate being delayed for a year, when patients go to the exchanges to say, I make X amount per year to qualify for a subsidy or a tax benefit from us, instead of going through the employer to verify their income, they now can just self-attest. So you can't tell me that that's not going to be a source of significant fraud. Now locally in Virginia Beach, we've seen some headlines. We've seen how the plans for both the city and the school have shown an increase in the deductibles up to 10 times. So a deductible from $300 to $3,000, that's what it says in that tiny little red circle. And 2 out of the 3 healthcare plans that's offered by the city are demonstrating premium increases. We've heard a lot of commotion from the firefighters and from the police. They're understandably upset about this. They're also raising the tenure from 25 to 30 years. And the net result for the city is that this is saving the cities and schools $17.2 million. That's not chump change, but then the employee contribution is increasing $8.8 million, which is also not chump change. This is cost shifting. So now I'm going to discuss what I've seen more personally. And we've all read articles, but I want to tell you what I have seen. So, what my patients are saying. In December, I had a patient who came in to see me who said they wanted to schedule surgery ASAP because their deductible doubled on January the 1st. I had another patient who told me that if she had her surgery performed before January 1st, it would cost her $50. If she waited until after January 1st, it would cost her $2,000. So, this isn't just stuff you're reading about, U.S. News Report. This is what I've seen. I also had a patient who I did a thumb reconstruction on, and that's a somewhat complicated surgery. It requires therapy to maximize your outcome, but she can't go to therapy because she had already maximized her visits according to Medicare. She had had a shoulder surgery done prior in the year. She had used up all of her allotment. That will affect her outcome. So what have I seen in my surgical practice? I have seen an explosion of regulations that are imposed by the federal government and by Medicare. We have this alphabet soup called PQRI or PQRS, depending on the month, where we basically have to check boxes in our electronic medical records to show that we are compliant. I say this death by coding because we have this immense coding regulation, which actually we're coming out with a new one. There was ICD-9, now it's ICD-10, which expands the number of codes that we have to use for diagnosis and surgical treatment, and it's hard to explain in a 20-minute healthcare policy talk how that influences my ability to take care of patients. But in our charts, we have to check off certain items in order to qualify for a code to be paid. And now that's made much worse. And when I, as a surgical specialist, am looking at a primary care provider's referral note for information on why a patient is being referred for me, I would say about 90% of that primary care provider's note is noise. It's all input for Medicare or for regulations, and it's very difficult for me to glean any meaningful information about a person's hand problem or arm problem from that note. So electronic medical records, we're all now mandated to go to those, and I will tell you that increases my time in the office, and I'm pretty facile with it, by approximately 20%. And I've seen also personally when I've recommended, say, an MRI for somebody's wrist pain, there is a much greater chance that MRI is going to be denied by insurance. It is very frustrating as a healthcare provider. Now, this is I can't say whom I work for, which is why there's a strategically placed pen over the recipient of this envelope. But this is just to show, if you can't read it, it says Compliance Document Services. What in the world is that? And how does that help a healthcare provider take care of a patient? I mean, this is just one real example. I saw it on my manager's desk, and I had to take a picture of it. This is obviously causing increased strain in our staff because they're having to spend more time checking boxes and doing different clicks. And I have already had to decrease the amount of patients that I'm seeing by approximately 5% because of this alone, to accommodate for the increased regulations. Because the flip side is, if I don't, then I'll be spending an additional 2 hours per day just going through and making sure all the regulations are adhered by. And you get to a point, obviously, where it's just not worth it. This is going to decrease access at a time where we're already experiencing a physician shortage separate from PPACA. So now, of course, it's unique. I'm not only a doctor, but I'm a patient. And this is what I saw when I went to update our family's insurance plan for this year. Our premium, and there's been no change in our healthcare history, our premium has increased $600, and some of our co-pays have doubled. Now, what I don't understand, President, is whatever happened to my premiums decreasing by $2,500. Yeah, this is real life. These are my real numbers that I got, just not what we hear, what I read in a newspaper. But as Charles Krauthammer has said, what's happening is exactly as it's written. The forecast 15 months ago is just showing that the storm is hitting essentially exactly as we thought. So here we see this memorable slide just showing again the complexity of the law with, of course, Kathleen Sebelius, the Secretary of Health and Human Services, at the helm driving everything. With the IRS here, you see IPAB, the rationing board for Medicare, and you see the president right here. Oh, there are the physicians, and the patients are way over here, extremely marginalized.